Good afternoon. I'm Clark County Commissioner Jim Gibson, and we're conducting today a virtual town hall and invite you to settle in and make sure that your equipment is working so that you can hear our voices. If you have any concerns at all, and if you have questions or comments, we encourage you to submit them to us on Facebook or other means. You can email to our District G email account, and we'll be happy to work with you after this meeting. We have received a number of questions that we'll be discussing during the meeting. But before we do that, I want to introduce you to the panelists that are on the town hall with me this evening. We have Dr. Furman Ligon. He is the Chief Medical Officer at Southern Nevada Health District. Chris Saxton, the Director of Environmental Health at the Southern Nevada Health District. We have Virginia Valentine, President of the Nevada Resort Association, and Catherine Jacoby, President of the Nevada Restaurant Association, along with Joanna Jacob, Government Affairs Manager for Clark County. We're really grateful to these panelists for being a part of this event this evening. We know that there are a lot of questions, and in fairness, I suspect we all have a lot of questions. Many of which we can answer, others we're not really sure yet. But our hope was to get to the bottom of some of the questions that have been put to us and see if we can explain some things that are going on. And I'll start by introducing the work that the Clark County Commission has been doing over these past weeks. We have 7 members of our commission that each represent various districts, the 7 districts that the Clark County area is divided into. We represent cities in some cases. In my case, I represent the city of Boulder City and about 2/3 of the voters in Henderson, along with the unincorporated Clark County. If you move up Boulder Highway to about Tropicana Avenue, that's the northernmost boundary of the district. In that area, over to Flamingo and other parts of the district, I have in my district both sides of Las Vegas Boulevard from Flamingo to Tropicana, and I have the east side of Las Vegas Boulevard from Tropicana out through the airport. That gives you a sense of the area I represent. All of Clark County is represented by members of the Clark County Commission. During these past weeks, we have been working with our constituents as questions arise. We've been working to provide support in the acquisition of personal protective equipment for the hospital at UMC and other hospitals and medical providers. We have been meeting with business owners and operators in an effort to help them understand what we imagine the reopening might be for them and getting them to imagine what the demands upon them will be. Our effort has been literally all day, every day, as we've worked to get to the end of things, and we're not there yet, of course, but we are to phase 1, which is a really important part of the recovery. And you know that last Thursday, Governor Sisolak announced in a press conference the opening that would be permitted of the businesses and industries that are going to be affected in phase 1. There are a lot of things that have been happening since that announcement, because he allowed as how those openings could begin 2 days later. So on Saturday, the openings began, and there was some movement, a bit more commerce. I'm sure that over the coming days and weeks, we'll see a whole lot more of it. I thought that maybe the first thing we might do is hear from Catherine Jacoby about the things that the Nevada Restaurant Association has been doing to ready itself and to transition itself into an open condition. One of the questions that you hear a lot, and we've read a little bit about it, is supply chain issues for the restaurants. And it might be that that is something that you've been working on feverishly to restore. Catherine, could you just tell us a little bit about what your organization has been doing and what the restaurants are facing right now as they begin to reopen?
Is that on? Okay. Our opening was very quick. Operators are having trouble getting supplies, and some of them have chosen to not open just yet. As everyone knows, there is a shortage of meat. We're certainly working on that. And also getting staff back in place, getting the restaurant cleaned up, and getting the supplies. Some are having a little trouble getting enough PPP, uh, and others are okay. They've been preparing a little bit longer than some of the others. Those that have been open for drive-through, um, they're a little better prepared. And again, depending on the configuration of your restaurant, as some restaurants have to work a little bit more to have the 6 feet distancing.
Thank you. We noted in a survey that we did from my district out to the businesses, thousands of businesses in my district received that survey. Many of them responded. Many of the business owners and operators responded. And one of the common concerns was, where do we find personal protective equipment, and where do we find enough cleaning supplies to sanitize our establishments and to keep them clean? We have plans. We know how frequently we feel we must clean them, but we've got to have more of the equipment and more of the supplies in order to do that. Is that something that you're working on, and that you feel as though you're narrowing the distance between what you need and what you can get right now, or what you have in place?
With that, we have several vendors listed on our website who still have supply. Those restaurants that have a strong relationship with their vendors are certainly in better shape than others. So again, we're working with a number of different vendors, and people can contact us or look at the website, and we can help them find the supplies that they need.
Thank you very much. We may also expect to see more of the restaurants opening in the coming weeks. What might you prepare us for in that regard?
Several of the restaurants are waiting until they can do it right. Again, a few of the restaurants are still having trouble with supply for their meat and other goods. Quite a number of our restaurants say probably mid next week they're ready to go. Again, those that already had a drive-through and curbside are in a better position to open that quickly. But our restaurateurs are being careful, and there's quite a few things that need to be in place. Just even clearing their water lines, getting everything cleaned. It's quite a task since they've been closed for so long.
No doubt. Our business license department has information for businesses that are working to that end. We have in our District G arsenal lists of vendors who can supply PPE and sanitation equipment and materials. So reach out to Clark County and encourage them to reach out to Clark County if they continue to have problems with that equipment. We'll get back to you in a few minutes. Thank you very much. Testing for the virus. And to Dr. Legan or Chris Saxton, whichever one of you would wish to respond. We know that we've tried to get ourselves in a position where there is more testing going on. And our hope is by midweek, we're able to achieve 1,000 tests a day. Could you help us understand a little bit better what our goal is? There was a time when we didn't have enough of the materials, the testing materials, to conduct testing. Have we made up that gap, and what might we expect, and who should be tested? Could either one of you or both of you weigh in on that question?
Hi, sure. This is Dr. Legan. Yes, right now we are testing multiple locations across the county. We have a capacity at the health district lab today of somewhere between 400 and 500 tests daily. UNC has a capacity today somewhere between 1,500 to up to 2,000 tests daily. And then in addition to that, we have the commercial labs that are available for medical providers, different medical offices across the county. The goal moving forward is to reach capacity at UNC up to 10,000 tests daily, and our expectation is that that should be available by June 1st. That's the plan. The public health lab capacity, our expectation is to reach 1,500 tests daily by the end of this month. Both places, UNC and the public health lab, also are expecting to have access to antibody testing. That most likely will be available by the end of this month. That's our expectation. And then we will be able to offer both antibody testing and also PCR, which have different applications. The PCR testing, which is the one we are doing right now, is a test that will tell you if you are infected today. The antibody testing is the one that tells you more about the history of infection. So somebody who might have been infected 2-3 months ago, today when you test for antibody, they will have an antibody response, and that would be shown on the blood. The main purpose for antibody testing in our community approach is to have an idea of what is the progression of the disease in our community. In other words, we want to know what proportion of our residents have been infected already with coronavirus, and that will help us in the planning of new interventions, how to offer better protection to our community, and also to different settings such as a hospital, nursing homes, and other business areas.
So who should park the question about antibody testing for just a moment? Who should seek to be tested? Is this now open to all of us, and we're hoping to do 10,000 tests daily starting June 1, and that's the entire community should be out getting tested? Or is it just those who are symptomatic?
No, the testing is being offered to anyone who requests that. Even today we are offering free testing to all residents in the community, and it is regardless of whether they have any sign or symptom of coronavirus.
That's really important to know. Let me move over to Virginia Valentine and the Resort Association, the largest employer in our county are the resorts and the gaming licensees. And as much as we may want to really get back to full throttle in the economy, it will require certain things to happen before the resort industry really can get there. What can you tell us, Virginia, about the resort industry, what they're doing, what we might expect to see in the coming week or two?
Thank you, Commissioner. What we're doing right now is preparing to reopen, and that involves everything from calling back employees, training them on new procedures and protocols for safety and for disinfecting. It also involves preparing the physical facility, which is now going to include probably some reconfigurations and some considerations for occupancy limits and social distancing, as well as sanitation and disinfection. And they are filling everything from the pantries to the casino cages to prepare for guests. In the gaming industry and for the large resorts, we know that it's going to take a while for people to feel comfortable traveling to Las Vegas. The locals market will probably come back first, and they're preparing for that. The resorts that are looking for drive-in guests are finding out what they can do to make people feel safe when they get here, and once they can ensure their safety when they do get here. Also, testing now is become a really big topic of interest. And when you think about how far we've come in just a short period of time, from a point when there were very few tests available, there was a shortage, and there weren't the supplies even to make the test, let alone to collect the test, to test the kits, and follow up on the results of the test. And so I have to say that everyone from University Medical Center to the Southern Nevada Health District to the state has done just a phenomenal job. So where testing wasn't readily available, it is about to be, and we think that's going to be a really important aspect for the resort industry as employers, or employers and guests.
When we might see the first of the, well, I understand, first of all, that the governor will be introducing more phases. And presumably the hotels will be in one of the upcoming phases. When can they be ready, would you imagine?
Well, the Gaming Control Board and the Gaming Commission, as you know, gave us some guidance on reopening. And one of the requirements there is that each resort hotel submit a plan within 7 days of the reopening. So I can't tell you when that opening is going to happen. We are preparing for it. The governor has not yet told us. And so what we are basically doing is standing ready to open, and with as much notice, hopefully, as possible, so we can get everything in place to welcome guests back.
Let me, well, so we'll be back to you in just a minute then, Virginia.
Thank you.
Chris, I wonder if you could tell us something about the flattening the curve. You know, we hear that term used a lot. What does that really mean? And is there evidence now with the things that we've been doing, the staying at home for Nevada, the social distancing, are we seeing some evidence that the curve is flattening? And if we are, what does that really mean?
Well, since that's more on the medical side, I'd like Dr. Lynn take that one if he's still here.
Good. Then Dr. Lynn, would you do that? Would you tell us what that means, and are we making progress?
Well, Dr. Lynn may have some connection issues, so I can speak to that. In a general sense, when you talk about flattening the curve, really it's about not overcoming basically what our hospital capacity is. As you know, some people that get the worst symptoms, they have to have a respirator. If we have so many symptoms, it overwhelms the hospital, and that's when a lot of people start dying because they can't get the care that they need. And so when we talk about flattening the curve, it's trying to keep that capacity below so we don't get in that kind of situation. I know we just hearing what the governor said, he's been reviewing all the cases throughout the state, seeing that curve is starting to flatten out. That's why he's moved to phase 1 to see how we continue to do with the limited reopening.
Thank you. For those who wish to communicate with us, if our email address is ccdist, DIST for district, so ccdistg at clarkcountynv.gov. And we're happy to do everything we can do to answer your questions, whether it's this evening or not is a question, but we will get back to you, answer any questions you may have. Let's go to the questions that have been submitted to us. The first one is from Shakura Ray. She asks when the casinos will open, and Virginia has helped us understand that we don't know yet, but the casinos are readying themselves to do it. And the rest of her question is, the Gaming Commission already approved the guidelines for the casinos to open, meaning they already followed the measurements of what they were supposed to do to assure safety of the guests and employees from the spread of COVID-19. So why not open? And I don't know that there's more you can add, Virginia, but if you have some thoughts to kind of close out that question, have at it.
Well, on May 1st, the Nevada Gaming Control Board did adopt the recommendations of the Nevada Gaming Commission did adopt the recommendations of the Gaming Control Board. And what they have issued, though, to us are health and safety policy guidelines. And within those guidelines, which require social distancing, disinfection, employee training, a whole plethora, the whole range of health and safety measures, then resorts, each resort is different, and they will submit a plan that is tailored to their facility and their operation or to the Gaming Control Board. So yes, they've given us some guidance and some policies, but we are still awaiting the all clear from the medical professionals to tell us when we can safely reopen and operate resort hotels.
Thank you. I think that's about as good as we can do right now, because until the governor opens the door, there really isn't much more they can do except be ready and continue to get ready.
That's right, Commissioner.
Now, the next question comes from Dee Dee. And it's essentially this: those jobs that reopened have hired their staff back mostly. She has concerns for the casino workers who are furloughed and have signed agreements to return back to work when they reopen. But there has been a furloughing or a laying off, one or the other, by at least a couple of companies that I'm aware of. One of the things that Dee Dee is concerned about is how we expect workers to find a job that pays the same amount they're used to. And she hopes for the extension of unemployment benefits and some modification to the rules around earning unemployment. This is a very detailed question with lots of nuances, but I think the bottom line is that the hotels are likely to hire back those they need. Is that a fair assessment, Virginia?
Yes, Commissioner, the resorts are not going to be able to open at the same level as the pre-COVID operations. So what we would expect to see is a gradual kind of a ramp up to normal operations. And as visitation increases and guests start to return to properties, they will open up more and more of the properties. So it's going to be a gradual process. Obviously, we'd like to get back to where we were before COVID, but it's going to take some time.
Thank you, Virginia. I think the final part of Dee Dee's question is probably one that the federal government may respond to. We're aware, we don't know the detail, and I'm not sure anyone even in DC knows the detail, but we're aware that there is a lot of discussion around additional help for individuals and businesses, and even maybe some help for governments. We know in Clark County that the revenues that flow from sales tax and other taxes are sure to have declined when we get those results. It's about a 2-month trailing report that we get. So the the tax revenues are reported for March in May, and we don't learn in real time what's happening to the taxes. We hope that there is enough of a recovery that we're going to be able to continue to provide the social services that Clark County is charged with delivering in Clark here to the county residents, and that's to all residents of Clark County that live in cities or otherwise. We know that the federal government is considering something that would be useful or helpful to governments. We don't know what is going to come down, but our hope has been that people will get the help they need to get through this difficult time. And we know that it isn't going to be easy for anyone. And we're going to do everything we can do to mitigate the horrible effects of all of this, but we're limited too. So working together, we're going to be able to figure out something. Whether we figure out everything, I think is hard and it's unlikely, but we're in it together, and we encourage you to reach out to us if you have questions, and we'll see if there aren't things we can help you learn about and get you in touch with the right people. Let's go to the next question. This is from a restaurant owner. And so we'll ask Catherine to take this one. How can we all collectively go against our insurance companies when they deny our business interruption claims, since it does not specifically call for pandemics? We're left without recourse. Have you heard that question, Catherine? Or is there counsel and advice you can give to business owners who are having difficulty processing business interruption claims?
This is a big problem and a big concern for us. As you may know, we've had several notable chefs file lawsuits against their insurance companies. We just recently did a webinar on interruption insurance, and we have several resources for you. So please look on our website or just give us a call. We have several attorneys that are working on this at no cost. Also, our National Restaurant Association is working on this in DC. So lots of folks are aware, and we are certainly doing what we can to correct the problem.
So could you give us your phone number and your email address so that folks who are listening can know where to go?
Sure. Our website is www.nvrestaurants, that's plural, .com. My direct line is 702-749-6660, and 702-749-6660. And again, we'd be glad to give you contacts for those that are working on this to get you some legal help.
Thank you very much. We know that the Restaurant Association has been very active on behalf of its members, and there are restaurants that are not members, but given the circumstances today, we need every restaurant to understand what it takes, and you're willing to help people that are members or not.
Absolutely, absolutely.
Thank you so much. We have a question from Steve Clares, Klares. He says that he has a brother that has a serious heart condition, and he worries about whether or not the result of the testing we're doing and the exposures that are out there have been measured in a way that suggests that we're winning on the question of flattening the curve and making it safer for people who are really at risk. And we've talked a little bit about how much more testing we hope to do. And you'll recall that Dr. Ligan said that the goal is to get to 10,000 tests daily. And Stephen, I hope that that's helpful in that regard. But what kind of special advice, Dr. Ligan, do we have for people that are really at risk?
Thank you. Well, the main advice for people who are high risk, and by high risk, we consider any person who has a chronic condition, whether it is a heart-related condition or respiratory condition, diabetes, asthma, immune depressive disorders, and also, as we have seen since the beginning of the outbreak, individuals who are 60 years and older, those are the highest risk for the disease. In our community, more than 78% of the people who die from this disease are 65 years old and older. So like basically almost 8 out of 10 people who die here in Clark County from coronavirus are people over 65 years old. And most of them have one or more of those conditions. So the main thing that we recommend for them is stay at home. If you don't have any essential thing to do outside your home, it's better to stay at home. If you have to be out, make sure that you keep social distancing. Also, make sure that you have some sort of facial tissue covering you, whether it is, a facial mask or any other tissues that could be used for that purpose. Also, if you need to consult with your physician because of any reason, before going to the medical office or the hospital, our recommendation is that you please call your doctor, because today most physicians, most medical offices are offering telemedicine, which doesn't require the presence of the patient at the medical office, and that also prevent you from being in close contact with other individuals who might actually have this disease, the coronavirus, and might spread that to you. Avoid social gatherings, especially avoid going to places where you have so many people around, and also avoid unnecessary visitors to your house if you are suffering any of those chronic conditions. But again, the main thing is to be aware of the information that is coming about this disease, because this is a new condition, and every week, every day, there are new things coming that we didn't know before, and it's important for us to learn so we can apply that to our daily life.
Thank you, Dr. Leguian. I wonder, Chris, could you tell us, will the health district be posting trend data that people can get at? And if so, where do they go for that information?
Sorry, what kind of data you said?
I was wondering if Chris could help us with trend data. Where are we trending? Because the governor has said that the trend is really going to be indicative of whether he leaves us open or not. We're anxious to see whether there is trend data that would be posted in a way that the public can get to.
Sure. Well, actually, we are creating and submitting every day information about trends of hospital admissions, new cases, positive laboratory rates, and other information to the county and also to the state. And we discussed with our team to start posting that information this week, so that would be available for anybody in the community to see. And what we are seeing from those trends, especially for the number of cases and hospital admissions, is that there is a tendency to decrease those admissions and number of new cases in recent weeks. And there is a curve that we have that can be seen. So we will be posting that in our website this week.
So is the website we're talking about your www.southernnevadahealthdistrict.org
Thank you. Yes, right. Yeah.
/ coronavirus. So any of you who are interested in watching that trend information, you know, Stephen, you ask a very good question. It's one that is personal to me. I am a type 1 diabetic. You can tell by looking at me, I didn't graduate from high school recently. And so I am one of those people who has to be very, very careful. And I am very careful. I have my face covering. I have my gloves. I am careful about where I go and where I don't go. I have been working from home. I am the president of a local business. We have 300 employees. We've only had one test positive, but we are very careful about what we do there. And I've been able to manage my own condition by being extremely careful. And so this is an important question to me and to a lot of other people. And I'm glad you asked it. And I hope that you can get and your brother can get some comfort about just living life again in due course. We know it isn't going to be overnight, but thanks for asking that question. We got another question, and maybe this is one that either Chris or Dr. Ligan can respond to from a hairstylist. We don't know her name, but what is indicated here is that because of the way that hairstylists have to have hands-on contact with their customers, it makes it extremely difficult. You can't social distance. The customer can't wear a mask because of the way it attaches, because it's hard to work on that person's hair. There are just all kinds of issues that the stylists are facing. Very worried about being able to get enough of a supply and keep a supply of disinfectants, sanitation equipment that is needed. Just a great worry, and wonder if the guidelines have made it almost impossible for them to really work on the one hand, and those are not within the power of anybody on this call. The governor has determined what the guidelines would be for the entire state, and the state of Clark County determined that we were not going to make it more difficult. Rather, we're abiding by the recommendations that the governor presented. But at the same time, we recognize that there is a challenge there. I don't know if Chris or Dr. Ligan wants to tackle that one. We understand that hairstylists are at risk themselves. And for that matter, I suppose that it could be a situation where asymptomatic professional could be performing the service on somebody who is vulnerable. So I don't know if you have any additional advice on something like this, Doctor or Chris.
Sure. I will start and Chris can follow. Well, honestly, this is a profession that requires a really, really close contact between the customer and the worker, and really, it's a huge challenge to comply with social distancing recommendations in that environment. I can't imagine how could it be possible actually, because there is no separation between the stylist and the customer. So again, this is something that is is the state make that decision. I respect that decision, but really, in terms of recommendation, I wish I could give her a recommendation, but there is no way she can do her job if she's not close to her customer, and then it will require some sort of respiratory protection, face mask or other tissues, and yes, if there is a client who actually is infectious, then there is a possibility that the transmission might occur. So it's really a challenging situation, especially this early in reopening.
Thank you, Doctor. I think that the one thing that we can say is that people are going to have to use good judgment. All of the people with long enough arms to abide strictly by the social distancing guidelines is already playing basketball in the NBA. So hairstylists are going to be in close proximity to people, and the people that are their customers will be extremely close to the stylist, and we just need to use good judgment. I think one of the other things that the governor may have mentioned is that if a person, whether that person is a prospective customer or a hairstylist or a barber, feels any symptoms, they need to make sure they get tested. And the proprietors of those salons need to make sure that they strictly enforce the guides that the governor has given. And to the extent that we're as careful as we can possibly be, then we're going to minimize the risk of infection. But more than that, it is really difficult to say. I hope that helps a little bit. The questioner get to the end of the concerns that were expressed. We have a question from Jason Buckley. The question is this: there were strict guidelines that needed to be met in order to start phase 1. Are there also strict guidelines that could make us step back to phase 0? And if so, what are they? Now, we've talked a little bit about the curve. We've talked about the number of infections. We've talked about the daily census in our hospitals and how many beds are available for treatment. And we know that all of those things are factors when the governor will consider whether or not to take a step back. He cautioned us that it was extremely important for us to abide by the guidelines. If businesses are open, they should do exactly what he recommended and what Dr. Leggen has been talking about today. If we are out in public, we should take care to use facial coverings or masks. And while my understanding, you can correct me if I'm wrong, Dr. Leggen, those facial coverings like the one I showed probably aren't going to prevent me from catching the virus if it's out there. If people are asymptomatic but infected, it may well help control or help decrease the number of infections because we're taking steps to try and keep things as contained as we possibly can. So I think that at the end of the day, the governor did not say to us that there are very specific things or we're going to take a step back. What he said was, we've accomplished a lot, and he was proud of the effort we've made. It is his call. And if we do the things that we've been doing, we're more likely to be able to continue forward with this recovery than if we take the position that, wow, things are now open so we can do whatever we used to do. That can't be. And we encourage people not to think that way. Anything more on that?
Right, and you're absolutely right. The main thing about the possibility of going back into reopening the economy or not is whether there is an increase in cases in the community. So as we said before, we are seeing a decrease in the trend with the number of cases and hospitalization here in Clark County and Nevada. Now we are reopening the economy. And then I have to say that we have to submit every day a report to the governor's office regarding the number of admissions, the number of new patients that have been diagnosed, the number of tests, what is the proportion of tests that are being positive in the community. So it's it's not just one indicator, it's multiple things that are being looked at. And the bottom line is that, we opened our economy partially last Saturday. Well, if within the next 2 weeks, we see there is a rebound in the number of cases, so like the trend is going back up again, well, that's a very negative indication, because that really means that transmission, a spread of the disease in the community is becoming strong again. So that's why we are monitoring this day to day. And my understanding, my expectation is that the governor is going to make a decision based on whether the cases are going up or not. And not only the cases, but also hospitalizations and other indicators, because we have to keep in mind also that we are increasing the testing. So if we are increasing the testing, also we should expect to see a higher number of new cases being reported. But there is a difference between new cases being reported and severity representation, meaning hospitalizations. That probably is the strongest indicator of the behavior of the disease in the community today. But again, it's a combination of multiple elements that will actually force that kind of decision.
Thank you. We hope, Jason, that helps you a little bit. We have a question from Brian McCule, Michael, M-I-K-U-L. Will the state of emergency, shelter at home, and stay of eviction remain in effect throughout the phases of reopening? So what I can tell you is that the governor has made it clear enough that social distancing and staying at home when one can is something that is fundamental to our recovery. And it would not be surprising to note that he continues to encourage us to telecommute, to work when we can, to stay at home when we can, to be careful when we go out and social distance, to keep washing our hands and keep things clean around us. Those are things that have been with a lot of people since their parents taught them that, their mothers taught them that when they were kids. And it is something that we need to get back to. The more restrictive things are things that this pandemic have suggested to us, and we know they work. We've seen the fact that they work. So we don't know what the governor is going to insist upon and encourage us to do, and what guidelines he may give us for the remaining phases of our reopening. But for now, we all need to be committed to help us all. This is about helping us all. Now, I have a question from Amanda Weller. As a person who puts physical health at the forefront of my life, it has been a tough 2 months not being able to go to the gym. When will gyms be able to reopen? And once again, we're not able to say when they'll reopen. The governor will determine from the available health data when he feels that the risks are such and they're mitigated enough that gyms can reopen. I do think that gyms are a place where it's a little more difficult. It's like the hairstylist who is in close proximity. In the gyms, people are breathing hard and perspiring, and there's a lot of opportunity for the spread of something like a virus. I don't know, Dr. Ligon or Chris, if you have any thoughts about it, but I'm guessing that it'll be a little while, but it could be anytime. I just know that if you're a gym rat or you love to go to the gym and work out and you're dying to get back there, I have a gym membership. I hope someday to do a little work on my midsection that is a little different today than what it was in March. But I recognize also that there are some unique risks associated with the gyms right now. Anything more, Dr. Ligon, about that?
Sure. I mean, if I would try to follow, I don't know what the rationale for having the hairstylist salons open during this initial phase. So if we look at that, that could be an indication that the gene probably might be in the next phase of reopening, because to me, it would be easier to control transmission in the gig environment than actually in the hairstylist environment. As long as the gene establish certain procedures and social distancing and limitations in how they use and share equipment, so that there should be a lot of details apply, but my point is, if you are able to open a hairstylist, which actually is a very, very close contact, a gene is simpler to open that kind of business. So I will assume that's very likely to be coming in the next phase.
And that would be exciting to any of us who really want to get back to normal, because our lives aren't the same if we're not working out. Have a question now from Scott and Lynn Miller. And since Chris has been on the phone and been real patient, maybe I can put this question to Chris. Has the county put a contact tracking system in place as recommended by the CDC? Is that a question that would be a good one for you, Chris?
Sorry, I will have to take that one.
So,
okay,
Chris, okay, Dr. Again, you take that one. I don't want to lose control here. So,
no, Chris is our specialist in environmental health, and he and his team, they have done a wonderful job writing recommendations for our business and what they need to do in order to open. And those recommendations are at our website, and also they have been utilized by multiple jurisdictions. A lot of people are asking for those recommendations, and they really are, they are really good. So anything related to food establishments, environmental health issues, Chris is there for you. But I would take this one. This is not for him. This is more about surveillance and
all right.
Investigation. So,
we're doing some tracking.
All right. Tracking diseases is part of the health district duties. Historically, that's an obligation for the health district, and also is one of the primary duties of any health department across the country. So we do that systematically. We do that for any infectious diseases, whether it is syphilis, HIV, tuberculosis, you name it. So doing that for coronavirus is just part of the same process that we usually do. Now, for coronavirus, because of the large number of patients that we have in the community, we actually had to deploy a staff from other areas into our surveillance or contact tracing unit. And right now we have about 60 employees fully dedicated to contact tracing, and that labor is not enough for the number of new cases that we anticipate, again, because of the expansion of testing. And we most likely will receive assistance from the National Guard. We're expecting that assistance from the state and also from other sources. But contact tracing is one of the primary duties of our staff.
Great, thank you. We've got just a couple of minutes. There's a question about tattoo clubs, from a Sessions Tattoo Club about tattooing and that industry. What can you tell us about tattooing, particularly because right now they are inspected twice a year by the health district, and they have partitions, and they have certificates relative to bloodborne pathogens, CPR training, all the rest of it. What do you imagine we can expect for the tattoo artists in the Valley? And we only have probably a minute.
It is.
Okay, really quickly, yes, we do regulate tattoo artists, our body art facilities, and we put out guidelines for them to follow, how to best prevent coronavirus in their facilities, how they can check up on employees, everything else. I would imagine, as Dr. Lynn guessed, for the fitness facilities, I would imagine body art would be coming with phase 2 is my best guess.
Okay. And so we can instill a little hope in this tattoo artist that maybe in the very near future he can get back to work. We received we've had a few calls about unemployment. You're going to need to continue to try and touch base with Dieter and the state in order to get answers about unemployment compensation. We have a question from a young man, or excuse me, from an 11-year-old, Michizaki. How will phase 1 affect the amount of the daily COVID-19 cases? Will it go up, down, or stay the same? And I think Dr. Legan has told us that we'll likely detect more cases for sure if we're testing more people. Do we have a lot of hope about phase 1 working successfully? I think all of us are hopeful that it will work successfully, but it is on us, as the governor said. And if we'll all do our part and make every effort to make this a success, we'll be able to do that. I want to thank the panelists who've been with us today. Thank you very much for tuning in. And we'll do this again, and hopefully we'll have more answers to other questions. Thank you so much.